The World Health Organization recently named Mercury a top 10 global health threat. Here's what you need to know. Mercury exposure, even in tiny amounts, can affect your brain, lungs, kidney, and immune systems, and it's especially dangerous for pregnant women and young children. One of the most common sources is methylmercury in fish and shellfish. It also shows up in some thermometers, blood pressure devices, and even skin lightening products. This is why the WHO is helping countries phase this out. But if mercury is high in your system, there are some things that you can do that we do in our clinic. So there are things called chelating agents. And these chelators will bind specifically to mercury. And there's other metals involved as well. And it can pull it out and you pee it out. So we have to be monitoring your kidney function. Now, let's say you want to do things more naturally. Like a lot of patients come in, they do chlorophyll. They do things to promote detox through their gut and their liver, or they're doing glutathione all the time. My experience is when we test these people for their tissue concentrations of mercury, those things have barely made a dent. We have to do strong chelators to get the best results. There are programs out there that do some very intense oral protocols, which I have seen some results with, not all the time. That's why for me, you're going to see I like numbers. We need to monitor your level, do the treatments, monitor your level again, and then we find out if it's actually out of your system. If you want to come in and get a mercury test, which I highly recommend, just send us a message and we're more than happy to help you out. We're based here in Miami, Jupiter, Florida, Ponte Vedra Beach, Florida, and Knoxville, Tennessee. Would love to see you soon.